are some signs that people should look out for that may hint that they should at least go check out a chiropractor?
Most often what I see is that people come in for pain. And 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 I think that's a great entry point. I think that that's a great place where you can see, you get into a chiropractic office for pain, and then you find out how much you can change your body with chiropractic adjustment, with the proper physical therapy exercises. The other part of it is not just pain, but there are tons of different issues that chiropractic can help with. There have been studies to show that it helps reduce the frequency and severity of asthma attacks, and there are lots of different issues that we can help reduce symptoms.
So why should somebody pick Aguilar Chiropractic over another one?
I think that people should pick Aguilar Chiropractic over another office because I'm going to go out of my way to make sure that you get better. There are certain standards of care. There are certain things that will be very, very similar from patient to patient because we're treating very similar disorders. But your care is going to get customized based on where you're at, what you're able to do. I'm not going to throw you into this treatment plan trying to get you out of pain when you're not in pain. We're going to move further along to the point where we're working on old muscle issues that need to be worked out, or if you've already done that with another chiropractor, we're going to go to the point where you've been in treatment, you're stable, you want to continue to be stable, so we'll just continue that. So it's always about each individual, making sure that you have all the tools that you can have in order to get better and stay better, and also about individualized care for every single person.
So where would you like to see your business go in the future?
So we haven't touched on this really. In the future, I would like my business to be focused. I would like my actual work to be focused on chiropractic neurology. So chiropractic neurology is so just like in medicine, you go and you get your specialization. In chiropractic, you can do the same thing. So I chose neurology because it seemed to me the most natural progression of what chiropractic is, because the chiropractic adjustment is so neurologically profound. It does so much for the way that your nervous system functions. So in that specialization, chiropractic is a tool to affect the nervous system in non-invasive ways, like using a specific chiropractic adjustment on one side of the body, or using light therapy, or using different kinds of stimulation that are all focused on changing the way that the nervous system works. So that's my goal, that at some point I want to be there. But before that point, I want to have another chiropractor here that has the same philosophy and the same expectation about how to treat patients. The same, essentially, I want to find a mini-me. But I know that's not going to happen. But I want to find somebody that is going to do what I'm doing right now. Will be able to take over what I do, because I'm growing my business in this neighborhood, and I don't want to move out at the point that I'm able to see patients that are mostly neurologically challenged. So I want to have that. I want to have this business grow into a place where it's still here for my neighbors and my friends, and that I can take care of these issues that are more complex and more troubling, and have a very large impact on families and care, and really getting people well, and or providing them with palliative relief where other things don't work. So in the end, I would like to see my business grow into a business where there's a secretary or a receptionist or a biller or whatever, and the chiropractor that is not me but has a similar philosophy, and then I'm doing stuff that is more related to chiropractic neurology.
What do you say to people who question the legitimacy of chiropractic medicine? Because me doing research, there was a lot of good stuff, but then there was this other side that people thought it's not real medicine.
Well, say the question for me again.
What would you say to people who question the legitimacy of chiropractic medicine?
So when people question the legitimacy of chiropractic medicine, I always talk about the studies that have been done that show how effective chiropractic care is. And then we also talk about one of the things I see very often is that, you go ahead and you get your treatment for you get an anti-inflammatory for the pain, or you get a Percocet or whatever narcotic to reduce your pain until that issue goes away. It doesn't really go away. It goes dormant. So while that issue is dormant, you're feeling better. You don't need your medication, and then it comes back because there was no change. And so that's a really important factor. Now, there aren't enough studies out there that show exactly what chiropractic can do, because chiropractors get really busy taking care of patients and getting them well, and research a lot of times I think has taken a back seat to practice, because chiropractors oftentimes have really big hearts and they really want everybody to get better and see as many people as they can, because there just aren't enough people that know about chiropractic care. So other things about chiropractic, people saying that chiropractic is not legitimate. I don't know. I don't have a great answer for that.
I mean, you had a good answer.
Okay.
That's fine. So what makes chiropractic different than regular? Well, you already answered that. I had to come up with 20 questions.
That's okay. Well, I can expand on that.
Okay, so what makes chiropractic different than regular medical practices?
So chiropractic is different from medical practices because traditionally medicine has been focused on sick care. So you go to the doctor when there's a problem. Now, chiropractic takes a more proactive approach. You're seeing somebody regularly. You're getting a really close relationship with this practitioner that you don't necessarily get with a medical practitioner. Now, there are plenty of medical practitioners that do that. Don't get me wrong. But what you often don't get is touch. Touch is a really, really huge effector on people's health. When I touch another person, they're going to change because I touch them. Now, depending on what I do, that change may be positive, it might be negative. So, touch has to be a healing touch. But that touch provides a lot for a person that we even don't know a whole lot about. So it's even mysterious as to why touch is so helpful. Another thing that chiropractors will see their patients more regularly than medical providers just because it's preventive care. You're trying to avoid getting sick. You're trying to avoid going back into those patterns, your body's patterns of unhealthy posture, of other habits. There are lots of unhealthy habits that people tend to avoid when they're seeing somebody regularly to make sure that their health is good. So you go to the chiropractor, you're a little bit less likely to get the fries with your burger, or you have a higher sense of health and what's important. And the other part of that is that chiropractors provide this, constant questioning. Okay, well, what are those symptoms like, and how long have you had this? And and you work and you talk about them on every visit, so you get to really know that patient. And so then when something starts to come up, when things start to creep up, you're right, that's not a huge deal, but let's talk about it some more in your next visit. And we keep talking about it, and then we find out, now it's time to go for some imaging, it's time to go for some lab studies, and those things are things that don't come up. Like you don't go to your medical provider because you're not in pain, you're not in enough discomfort, you're not having enough trouble to warrant that actual stimulus to say, oh, I got to go to the doctor.
So what impact do you think chiropractic has on the rest of medicine as a whole? Or what impact do you think it will have?
Well, yeah, there's so many changes coming with healthcare right now. The impact of chiropractic on medicine in general, the potential is huge because we can screen. There are so many ways in which we can help people to prevent them from flooding emergency rooms with pain issues, or to reduce the number of visits that they have to go to their MD for the painkillers, for the anti-inflammatories. So we can draw a step out and be, I wouldn't necessarily say a filter, but to help sort of reduce the amount of stress on the system of medicine, and also at the same time get people focused on how to take care of themselves rather than the pill fixing it. And that's another thing, chiropractic can reduce the amount of medication that people have to take. So, I don't always think that, we're going to reduce all the pain on every patient. That's just not always going to happen. There are ways in which medicine is there are ways in which the allopathic, the medical community, does a lot for people. But if we can take the stress off of them in order to give them more leeway to spend more time with the more complicated issues rather than having to face the dailies of aches and pains and other issues. And also at the same time, like I stated earlier, when we're talking about what chiropractic can provide, you can also see more things coming. A chiropractor can see things that are happening to a patient as they happen on those regular visits and give them an idea of what they need to do to correct their health or get them to the person that can do it.
Right. So what was your biggest motivation for doing what you do?
My family and my patients are the biggest motivation for me to do what I do, because I'm a better person at the end of the day. So I'm a better person for my family. And at the same time, my patients, when they get better, I get better. When they're not getting better, I get more educated and I learn what needs to be done next. I find out what I'm not doing and learn how to change me to be a better provider for each patient.
So how can people find out more information about Aguilar Chiropractic?
The best way to find out more information about Aguilar Chiropractic is to ask me or schedule an appointment and we do an examination. Then I think probably the easiest way is to check out my website, www.aguilarchiropractic.com. It's AGUILARCHIROPRACTIC.com.
Well, thank you so much. All right, so